Long delays to NHS care for children in England is creating a forgotten generation. I'm going to read into this more from The Guardian, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from The Guardian with the headline of long delays to NHS care for children in England is creating a forgotten generation. Health leaders say critics' crisis is so severe that there is a deep concern that lifelong harm is being caused. Guys, while you're here, make sure you hit the like button and share it across social media so others are notified of this video. If you wasn't already aware, if you wasn't already living under a rock, let me remind you that the NHS is in great deal of crisis, and because not only is it a crisis for adults, for elderly, and more senior civilian citizens of the British public, but also for our children as well. And it's even worse for our children because then it hampers their futures. And as it said rightfully there on the bulletin, lifelong harm, because once the damage is done at a young age, sometimes it can never be fully repaired. And it's really, really important that our children, I mean, we know that there's a dental crisis, for example, and there's not enough NHS dentistries, which is a major, major problem as well. We know that that's a major issue as well, because many, many parents have had to fork out hundreds of thousands of pounds to get them into private healthcare, because there's no public dentistry around where they are, which is absolutely insane. Or that they're booked up and they're full because there's been cuts to the dentistry, been completely abandoned by the Conservatives. You know, there's a lot of people who are desperate in need of that, and that's just one area that children have suffered as a result. It's going to, unfortunately, as much as this pains me to say this, it's going to take time for the NHS to get some kind of stability. Now, I absolutely despise West Streeting because of comments and things that he has said, even recent things he has said about puberty blockers as well, which has been covered on other channels. I mean, yeah, I just think he's a terrible appointment for the healthcare sector, if I'm absolutely honest. But unfortunately, he is the health secretary, whether we like it or not. And the only thing I can say is I just hope he gets the health backlog sorted and get the NHS waiting list down, and makes it makes healthcare available to as many people as possible, as quickly as possible. But like I said, it's going to take time for it to recover. But unfortunately, we are already losing children as a result of the 14 years of austerity, the 14 years of damage that the Conservatives have caused to the UK, England in particular. So thousands of children's lives are being blighted by shocking delays to NHS care for up to 3 years, according to a report that warns a forgotten generation will suffer long-term harm as a result. The health service is struggling to cope with rapid rise in demands for increasing complex and acute care needs among children and young children, the research by the NHS provider has shown. Health leaders say the crisis in England is so severe that there is now a deep concern that lifelong permanent harm is being caused by crippling delays to NHS care. Long waits for basic health care are derailing children's development, educational attainments and mental health, they reveal. One trust reported that waiting times for children autism assessment had risen from about 14 months before the COVID-19 pandemic to 38 months today. Children are also being forced to wait too long for essential speech and language therapy, hearing tests, medical treatment and surgery. This I can absolutely vouch for certain. I have, there is a relative of mine, and a relative of mine who I'm fully aware of, and one of her daughter has a speaking issue, born with a speaking disability issue. So when it comes to speaking, it's very hard for her to be able to speak at a very young age. And she's been trying to get language therapy and essential speech, and it's proven to be extremely difficult. I know, obviously, the argument, obviously, of that the daycare that she is supposed to be playing their part too, but let's just say they've not been helpful. But I can definitely attest to this, guys. And bearing in mind, this is in London, that the case I'm talking about specifically, in central London. I'm not even talking about outside London, where the situation is even worse. So that speaks quite volumes about, it's not, yes, while it is worse outside London, these issues are also happening in London as well. So I just wanted to make that point quite clear. The report by NHS Providers will represent hospitals, communities, mental health, ambulance trusts in England say 82% of trusts it surveyed were unable to meet the current demands for children and young people's service. Too many young lives are being blighted by delays to accessing vital NHS care, said Sir Julian Harley, the chief executive of the NHS Providers. We're in danger of seeing a forgotten generation of young people. The study follows a series of reports in The Guardian exposing the child health crisis in England. Yeah, I've covered quite a lot of healthcare crises, from mental health to healthcare news. If you check out those playlists on the channel, you'll have a look at some of the past ones that we've covered on the channel here. In February, the newspaper revealed how the number of children referred to emergency mental health care has risen by more than 50% in 3 years. The increase meant that more than 600 mentally ill children a week were deteriorating to such a state that they had reached a crisis point, according to a review of NHS figures by The Guardian. In June, this newspaper disclosed how children were getting shorter, fatter and sicker amid an epidemic of poor diets, food insecurity and poverty, with millions facing a time bomb of avoidable health conditions. That came after The Guardian exposed how the Conservative minister warned that putting children at lifelong risk of ill health by shelving politics to tackle obesity, junk food until 2025, but pressed ahead anyway. The new report by NHS Providers included 134 respondents from leaders at 95 trusts. Almost 97% said the current level of demand for children and young people's service had increased compared with before the pandemic. Of those surveyed, 86% of those waiting times to access initial assessment had risen. The key challenges were the growing complexities of children's health conditions, the severity of these conditions, and insufficient services being commissioned, they said. The shortage of staff was also highlighted as a major barrier to treating youngsters. Trusts are not being able to provide the adequate care for also affected staff morale and contributed to widening health inequalities. Most long-term health conditions develop during childhood, the reporter says. For example, 75% of mental health problems occur before the age of 24. And eventually, during this period, there is therefore critical to improve children and young people's health outcomes both now, in the present and into the future, ensuring a healthy and thriving society and population in the long term, studies said. Yeah, I think everybody can agree to that one. I don't think anyone will dispute that. Hartley added that long waits for services have far-reaching implications for a child's social development, school readiness and educational attainment. Preventing ill health among children and young people is central to ensuring the next generation are able to live well, thrive and contribute to society and the economy. Yep, again, I don't think anyone disputes that. NHS leaders need more to support and deliver safe and timely healthcare to children, he said. This means cast iron commitments from the new government and the NHS England that the physical and mental health of children and young people will be a priority, with the right amount of mix of NHS staff to give them the care that they need. Patricia Martisk, an executive director of the Royal College of Nursing in England, said the crisis requires urgent intervention. When NHS leaders say staff shortages are preventing them from delivering its service to children, it's time for action, she says. David Fostergill of the Local Government Association said it was worrying to see so many children were not receiving the timely care that they needed, particularly because of the potential long-lasting effects of the future health and development. A Department for Health and Social Care spokesperson says it is unacceptable that too many children and young people are not receiving the care that they deserve, and we know that waits for services are far too long, and we are determined to change that. They say they're determined to change that, but are they going to be able to do it, guys? Are they going to be able to make those changes? That's the question we have to ask ourselves. And in all seriousness, I really hope they do. I really hope they do. I have as much as I don't trust West Streeting, I feel much better. I have slightly better confidence in him and Labour with this than I do the Conservatives, because the last 14 years pretty much speaks for itself, guys. It speaks for itself, the damage that has been caused. So I am optimistic, but at the same time, I'm also cautiously optimistic as well, because because of the situation. But like I said, it is going to take time. They are going to do everything that they can. I generally believe that the government is going to do whatever it can to help, but it's just going to take time. And I do believe that Labour does care about children's future. I know some people are very critical, but you know, let's get these children the healthcare they need. Let's give them what they need. Let's give them the lessons that they need. Let's give them the best and brightest future that they possibly can. I know it's a long way off right now, but like Keir Starmer has said when he became Prime Minister, actions, not words. And yes, I know it's only still been a week or 2 weeks or so since he became Prime Minister, but we got to give this Labour government a chance to prove themselves, guys. So let's hope that they can deal with this crisis. So what do you guys honestly think? What do you guys make of the NHS care for children in England at creating a forgotten generation? Are you surprised by this? Are you shocked by this? Does this raise even further questions about how detached the previous Conservative government have been when it comes to looking after our children? Let me know and your thoughts and more in the comment section down below. If you found this video informative, please hit the like button, be greatly appreciated. Share it across social media so others are notified of this video, and subscribe because it really does help support the channel. And if you want to go one step further, financially support me and the work that I do here, you could do so by becoming a YouTube member for as little as 99p, or join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching. I hope to catch you all very, very soon.